At Charlotte Skin and Laser, we treat a number of patients with scars and a variety of different scars. Let's start talking about kind of traumatic or surgical scars. There's a lot of different treatments for these, and the biggest message I try to get across is that earlier intervention is more ideal than waiting. There's tons of evidence that treating scars early leads to better outcome in the scar. Some of the early interventions include things as simple as using a silicone gel or cream or sheet at home, but early intervention with a pulse dye laser, which is called V-beam, has been shown to not only hasten healing of the scar, but also improve healing of the scar. Also, Botox injections around the scar have been shown to help improve scar healing. And we may do these also with injections. If it becomes a thick scar, we will inject a combination of medicines, including steroid and a medicine called 5-fluorouracil. So scars heal on their own, or surgical wounds and traumatic wounds heal on their own. But there's no doubt we can enhance that healing with treatments such as laser interventions, topical treatments at home, and even injections in the clinic. Acne scars is kind of another beast, and I like to, number one, aggressively treat acne in an effort to prevent scars in the first place. So that's an important aspect of the medical side of Charlotte Skin and Laser. But we have a number of patients that come in with acne scars, and we take a multimodality approach to the treatment of these acne scars. We use a variety of techniques tailored to each individual based on the scars that they have. The first treatment we will often recommend, and we can do this even while you're starting your acne treatment, is treatment of the red scars, the red marks left behind from acne scarring. And this is done with the V-beam pulse dye laser. This can even be done if you're on the drug known as isotretinoin. So early treatment can be done. If there are texture scars, we can use our lasers and devices like the fractional 1550 and our radio frequency devices. We use Viva, microfractional radio frequency, and our Infini Genius, which is radio frequency delivered through microneedling. We also use what's called the TCA cross technique, where we use strong concentration of TCA acid. It's put on via a toothpick to ice pick scars. And some scars that go very deep develop vertically oriented scar tissue that kind of tethers the skin down. I describe it like ropes holding a balloon down. And we often see referrals from patients that have had a lot of treatments and they say, well, it's not working. And I think that's often because with these deep scars, there are scar fibers holding the skin down so it can't respond. We treat that with a procedure known as subcision, where we attempt to break up those vertically oriented scar fibers using kind of a spade-looking needle. We put all these together in the same treatment session. So if you have some ice pick scars, you will get the cross technique. If there's scars where I suspect there's vertically oriented scar tissue, we'll do the subcision. We'll do the V-beam pulse dye laser treatment for the red scars, and we'll choose a laser energy device to stimulate collagen renewal on the depressed scars or the scars that show up with shadowing. So putting together a treatment plan for you is critical to success for treatment of acne scars. And we will individualize plans for you in a customized approach, and our focus is on getting you the best results possible and the highest probability of success.